Hey everyone, how's it going? Thank you for your support. Hope you had a happy Thanksgiving. So I'm Dr. Jackson. I am the owner here at Paws Animal Clinic and Urgent Care. I used to do these live sessions when I lived in Vegas, and I found them very helpful just for educational purposes and just to connect with my followers that I may not necessarily see. So I do appreciate you all. I'm gonna try to answer any questions that you may have. So definitely drop your questions in the comments, send us DM messages, and we'll try to address them as we get them to come in. So again, I'm Dr. Jackson. A little bit about myself. I am from Mansfield, Louisiana, born and raised a country boy, but now I've been translocated to Atlanta, and I've actually enjoyed Atlanta. I have quite a following here, and great clients, helping a lot of pets as well. So I started Soft Paws Animal Clinic and Urgent Care a little bit. Actually, we started off as Jackson's Veterinary Services. So if you look in our background, you can see we started on a mobile platform, and since I have gone into brick and mortar, and we've been quite busy actually. At this current moment, we're not doing mobile services in the Atlanta area, but we hopefully will start that back in 2026. So Soft Paw started with just a table, tent, and a cooler, and we would go to lower income areas and set up in the community just to kind of help out the pets or the people that didn't think they could necessarily afford veterinary care. What I learned through, I guess, my research is that it's not that the individuals couldn't afford the care, they just didn't know what they were supposed to be doing. So since I started doing educational videos just to get the clients acclimated to what they should be doing with their pet and the things that they see, they would know kind of what those things mean. So we've developed a following, and now I have made it my duty to continue to educate everyone. So we appreciate your support with watching the videos. Definitely make sure you follow us on all platforms. We're also on Facebook, Instagram as well. Definitely make sure you're following us on YouTube, because there will be more lengthy videos just to kind of talk more in depth about the cases and everything that we see. So we practice in Louisiana, Nashville, of course, Las Vegas, and we have made Atlanta home. For my followers that's out there and you don't live in the area, if you happen to come to Atlanta and you want to schedule a meet and greet, we are open to that. So definitely let us know so you can swing by. We can take pictures and all of that. Also, if you have young kids that's interested in the field of veterinary medicine, definitely let me know, because it's kind of hard to get into the field if you don't have or know have someone or know someone. So I would love to be an avenue to get a kid or even an adult that's interested in animals into veterinary medicine. So just definitely let me know. I'm open to doing that. So general pet health questions can be answered and asked, and then I'll make sure I reply with an answer for you all. Sometimes you see things at home that's actually a problem with your pets, but you just don't know. So if you see something, you can always record it, submit it to us, DM us any questions that you may have, and we'll make sure we get them answered for you. So the craziest case I've seen was probably a tumor that was benign. So the pet did not have terminal cancer or anything like that, but the mass itself was about 15 pounds and the dog was only 60 pounds. So that was the craziest case I had. I only started with that because one of my subscribers asked me to just talk about the craziest case I had. Immediately after that surgery I did, the dog literally lost 15 pounds because the tumor was just that heavy. So I just wanted to make sure I addressed that. So in regards to animals, there's a lot that goes into what you see. A lot of times, as a pet owner, you learn a lot just by owning a pet. But for those individuals who's interested in, owning a dog or cat, or anything like that, but you're just nervous or you have anxiety, we can also help you with that. We can definitely talk about, the health care of that particular animal, what dog or cat may be best fit for what your needs or desires are. So you don't have to have anxiety about that either. We are also open to consultations with without you actually living in the area. So if you would like to, schedule a virtual meeting, a case review, etc., we can do that. We are building a nonprofit as well, off of the animal hospital, because we've noticed that there are a lot of people that just can't afford certain things when it comes to their pets. So we just want to do what we can to bridge the gap. Not only will we be helping pets with their health care, but we will also be aiding in mentorship, public speaking engagement, appearances at middle schools, elementary schools. We would love to do petting zoos and things like that. So January 2nd, we do plan to roll out our nonprofit. So just be aware about that. We would love your support. Make sure you follow us, and then we'll also post the stories about who we've helped, the cases of the pets that we've helped, just to keep you all engaged. So our platform has kind of gone globally, so we also want to keep all of our supporters involved, even though you're not local. So if you stay tuned in, we'll always post updates about the cases and things such as that. So how did I get into veterinary medicine? Well, I was raised in a small town, of course, Mansfield, Louisiana, where, a town of, everyone basically knew each other. So my uncle Dale Ross would come and pick me up every day, and we would go work cattle. Fun fact, I actually used to rodeo. I know that may sound crazy, but yeah, I used to rope cattle. I did a little bit of steel wrestling and things like that. But although I don't wear my boots every day anymore, I'm still a country boy. So got into veterinary medicine by way of my uncle Dale. I went to Southern University in Baton Rouge, where I had a family member who worked at the university that was also a veterinarian. She's in academia, and I love medicine, so we just kind of helped each other. I definitely wouldn't be where I am without her, Dr. Renita Marshall. She's over at Southern University. So if you have any students interested in animal health, animal medicine, veterinary medicine, I would encourage you all to contact Dr. Renita Marshall at Southern University, and she is located in the ag department. She would be a great avenue to get you in the door. If you have a kid that's getting ready to go to college, or someone that's already in college that's just interested in veterinary medicine. Went to Southern University and graduated. Then I went to Tuskegee and I did a master's degree at Tuskegee in animal and poultry science. And I also went to veterinary school at Tuskegee as well. One of the greatest institutions that to date, in my opinion, in regards to training the students. I graduated knowing how to do whatever I needed to do. So I was very confident, had a lot of practice, but still you have to be in a place that's willing to nurture what you're doing. So graduated Tuskegee, and I went to work in Houston with some colleagues. I also got promoted to a medical director gig in Las Vegas, and from Vegas I went to Nashville, where my mobile practice really took off. And from Nashville, I relocated to Atlanta, Georgia. So we're here. We're here to stay. We are planning to, expand our service area as well. So if you have an area that is lacking in veterinary care, let us know, and we'll see what we can do to try to help out. Um, I got a question. How was the Navily for you? To be honest with you, when we all are so for you all that don't know, the Navily is the exam that allows us to practice veterinary medicine, and we have to pass it in order to be licensed. That test for me, I feel like was it's stressful for everyone because you just don't know how you're gonna do. I passed with flying colors, but at the time, especially when you're taking it, you don't feel like you did well. So a lot of times when you're studying for Navily, you just have to be very confident in what you do know, and don't let the fears and the anxiety sneak in. But if you would like to talk more about that, or if I have a lot of vet students that's following me that have interest in knowing, how Navily was for me, definitely DM me because we can set up a separate Zoom call or something to talk about that. Um, but yeah, so we're gonna get started. The top wellness things you need for we're gonna talk about dogs and cats. So your dog. Typically, you're going to get your dog as a puppy. So puppies need annual vaccines, but the vaccines first must be boosted, which means they have to get multiple vaccines in a short period in order for them to be an annual exam. So the main vaccines your pet would need would be rabies. The rabies vaccine is legally required, guys. That's not something that we get to choose about. And if you don't want to vaccinate your baby, you do have the option to do titer testing in some states. But the rabies vaccine is something that you must get. We are not in control of that. It is federally regulated, and it has kept the entire United States safe in regards to the rabies virus contracting human contracting the rabies virus as well. Also, if you don't have the rabies vaccine, it is possible for your pet to need to be quarantined for a minimum of 10 days. And in certain cases, sometimes, unfortunately, your pet may need to be euthanized so that we can do the testing for rabies. We haven't had to do that, especially here at our location, for quite some time, just due to how well the United States veterinarians do with vaccinating rabies. But you definitely don't want to not get the rabies vaccine. If you don't do anything else, make sure you get the rabies vaccine. All right, for dogs, number two, one of the most important vaccines outside of the rabies vaccine is the distemper parvo combo vaccine. That vaccine prevents the pet from contracting parvo, distemper, other illnesses. A lot of times, although it's not legally required, if you do not get the distemper parvo vaccine and your puppy goes outside, they can contract parvo, which costs thousands of dollars to treat and is extremely expensive. Honestly, out of 10 cases, we may be able to hospitalize two due to how expensive it actually is. So the vaccine's less than $40. It's more cost effective for you to get the vaccine compared to try to treat parvovirus because it costs thousands of dollars. Um, the next vaccine I'll talk about in regards to dogs is Bordetella, which protects against kennel cough. So if your pet is going to dog parks, daycares, anywhere that there's multiple pets, you want to make sure you get the Bordetella vaccine. It's not something that's typically fatal, but it can cost you a lot of money, and the pets just don't feel well if they get sick. All right. She said, my cat has a 3-year rabies. Oh, that's amazing. So sometimes your pet may qualify for a 3-year rabies vaccine. If your pet does not get a 3-year vaccine, a 3-year rabies vaccine, the only other option is a 1-year. So if you have a good rapport with your veterinarian, you go in on time, a lot of times you can request the the 3-year rabies vaccine. That way you don't have to get it every single year. Yes, my cane corso has kennel cough as we speak from the dog park. Yes, it's now let's talk about that a little bit. And we're not going to get too sidetracked, but the only way we know that it's kennel cough is if we test it for it. So a lot of times we will treat for kennel cough. It is one of the more common things. But keep in mind that your baby also can get canine influenza, mycoplasma, other respiratory illnesses. So if you go to your veterinarian, I would encourage you to request testing to be able to diagnose whether it's kennel cough or if it's something else. So make sure you get your Bordetella vaccine. So we've talked about 3 vaccines so far. First one is the rabies. There's a 1 year or 3 year. Most of the time, a 1 year is required before your pet may qualify for a 3 year vaccine. The second vaccine was the distemper parvo vaccine. And then we talked about the Bordetella vaccine. Another one that we should speak about, although it's not a requirement, is called leptospira. This is a lifestyle vaccine. And when we say that, that means if your pet's lifestyle includes going to dog parks where there's lakes, standing water, even in your backyard. If you have standing water in your backyard, leptospira is a bacteria that can live in that water. And if your pet drinks the water, lays in the water, comes in contact with the water anytime, especially if it's contaminated, they can contract leptospiral bacteria, which is typically fatal. And most of the time you'll see jaundice, which means your pet will look yellow. Any white area would typically look yellow. A good place to look is in the ears, the eyeballs and the gum line. So if you look at your baby's gum line and it has a yellow tinge color to it, then a lot of times that's jaundice. Although leptospira is not the only thing that causes jaundice, that's one of the things you'll definitely see. Keep in mind that leptospira bacteria, or that illness that your dog can get, is also zoonotic, which means human can become contracted with leptospira as well. So this vaccine is optional based off of lifestyle. However, if your pet's going to go outside, be an outside dog, it's better to get it, because if your dog gets leptos bacteria, then a lot of times they do pass away. It's probably a 98% chance that they will pass away. They will also have to be hospitalized in isolation, which is extremely expensive. And a lot of times they just don't do well in the hospital. And keep in mind, this is a human being, a veterinary nurse, or sometimes even the veterinarian, that's having to go in to treat a patient that can actually get us sick as well and cause us to pass away. So it's better to just get the vaccine than to have to worry about all of that. I'm learning that a lot of clients just aren't aware of the ins and outs of a lot of the stuff. I appreciate my clients. I love them. They trust me, but I also want them to know what their pet actually needs, because if they don't, they can end up declining a vaccine that can be life-threatening not only to their pet, but to them as well. So there's 4 vaccines we've spoken about in dogs. I'll also include the influenza vaccine. Canine influenza is kind of tricky because the strand changes very frequently. But if your pet is going to, daycare, dog parks, anywhere where there's multiple pets, it sometimes is best to just go ahead and get the vaccine on a preventative basis in hopes that you're vaccinating for the right strand. Some places will not take a pet if they don't have their vaccinations. Also, one thing you want to look out for is if you're going to boarding, grooming, pet sitting, any of those things, training, and they're not asking you for your vaccine history. They're not asking you if your baby's on flea prevention, heartworm prevention. I probably would ask questions before leaving my pet there, because if your pet's not vaccinated, imagine how many other pets there as well don't have vaccines. So you can end up bringing your baby back home that's infected with kennel cough, parvo, influenza, etc. Um, as far as the parvo vaccine, you want to make sure that if you have a puppy that's not fully vaccinated, you should not be going outside walking the puppy on the ground, because a lot of times they will end up contracting parvo. They can get it from the soil. So if you do have a puppy that's not fully vaccinated, I would advise using puppy pads inside of the house until the baby's fully vaccinated, and then you could slowly start changing the training to using the restroom outside of the house. So a lot of times, if you come to the veterinarian, I would encourage you also to ask them, why do my pet need this? Just so that you're fully understanding of what they're offering before you decline it, because a lot of times you may be declining something that they may desperately need. All right. Any questions about the dog vaccines? Anyone? Yes. Dogs can get disease from kissing bugs, as well as fleas, ticks, other insects as well. So they can definitely become infected, which is why you really want to do what you can to keep them vaccinated, keep them on their prevention so that you don't have to worry about things like that. So we talked about dog vaccines. Let's go a little bit further into the other wellness services that's recommended. Number one, I would say a fecal screening or a fecal test. So if you're going in with your pet or your cat and you can take a fecal or a poop sample, please bring it with you, because it will minimize anxiety with your pet if we have to get a sample. But also, you want to make sure you get that test done. There are so many parasites that exist, and yes, we can prescribe a dewormer, but we want to prescribe one that's going to work well based off of the parasite that your pet has. Every dewormer does not take care of every parasite, and the only way we'll know is if we do fecal testing. So when you go into the veterinarian's office, do not decline the fecal test. That is desperately needed, and I recommend at least once a year testing for parasites, as long as your baby is staying on the heartworm and the flea prevention. Heartworm, flea, and tick prevention. Along with the fecal test, if your baby is 6 months of age or older, they should also get a heartworm test. And this is dogs and cats. They technically should get at least one heartworm test a year. Keep in mind that it takes 6 to 8 months for heartworms to develop in dogs. So it's no point in us testing them before they're at least 6 to 8 months of age. So that's why you're able to get heartworm prevention up until 6 to 8 months of age before we require heartworm testing. So just remember, when you go to the hospital and they're asking you for that heartworm test, don't decline it, because that test will test for heartworms, and it's literally worms living in the pet's heart, and they can pass away from that. A lot of times, keep in mind, it takes 6 to 8 months to develop. So by the time we catch it, they've at least been infected for 6 to 8 months. If treated correctly, a lot of times the fastest way to get rid of it, it still may take 6 to 8 months, if not a year, to fully treat them to get rid of it. Once the heart is damaged, it is not repairable, and the kidney also is another organ that once the organ is damaged, there's no way to actually repair the tissue. So if the heartworm migrates through the heart and causes damage for a year and a half, although we may get rid of the heartworm, we could never get rid of the damage the heartworm did to the heart. So just keep that in mind. Dogs that has had heartworm disease sometimes have chronic coughs, chronic heart issues, simply due to the amount of damage the heartworm did. So just keep in mind that when you go in, make sure you're getting your heartworm test. We can't refill heartworm medications without having that heartworm test once a year, just to make sure the pet is still negative. Because if they are put on heartworm medication or prevention without knowing that they are positive, it can cause medical issues and sometimes cause them to pass away in the midst of us just trying to take care of them. All right. So fecal testing and heartworm testing are also two other things in addition to the vaccines that you want to get done. Of course, there's nail trim, ear cleanings, things like that. One thing I would say that you also want to be educated about is anal glands. Anal glands live by the rectum. Every time your pet has a bowel movement, they should express the anal glands. But what happens is if they're too overweight or for whatever reason, they're not expressing the anal glands every time they have a bowel movement, the fluid just sits there. And ideally, the scent glands or the anal glands are scent glands. So every time your pet have a bowel movement, they normally are marking their territory. So it is a form of marking. So when they have a bowel movement, they express their anal glands to mark territory. Well, if they never express their anal glands when they have a bowel movement, that fluid, which ideally is the consistency of water, it turns into toothpaste. And at that point, it's almost impossible for the gland to express. So it gets infected, turns into an abscess, and sometimes you'll notice an ulcerated room right by your pet's rectum. So if you see your pet scooting on the butt at home, that is a sign that the anal glands may need to be expressed. So don't ignore that, because sometimes if you catch it in time, it'll prevent you from having to spend a lot of money, and also prevent the pet from having to go through anal gland issues as well. So just a summary for dogs, we talked about making sure they get a rabies vaccine, distemper parvo vaccine, bordetella vaccine, a leptospiral vaccine, and an influenza vaccine. I know that's a lot. Just try to do your research on them to educate yourself about it, so that when you go in, you're fully understanding of what's being offered to you, and you know how to handle that. In addition to the vaccines, you want to do fecal testing, heartworm testing, and bare minimum anal gland expressions as needed. So that's to wrap up the dogs. Any questions about that? Any questions, anyone? And if you all can, make sure you follow us on all platforms: TikTok, YouTube, Facebook, and Instagram. We would love to see you all on all platforms. I've kind of taken the responsibility to educate people that's not as familiar with what's going on with their pet. So if you can help me spread the word, I would appreciate it. So we got a question. Doc, what's your best flea medication? Well, the best flea medication is going to depend on the area you live in, but also the pet's ability to take it. So if you have a hard time getting them to take medication, and half of the time you don't know if um, they ate it or not, you may want to do a topical medication, because a lot of times if they take the treat and they spit it out, then that means they didn't get medicated, and that can set them up at risk for contracting heartworm disease, fleas, ticks, etc. I personally love Simparica Trio. Of course, guys, there's a risk with all medications, even in human medicine. But what you want to do is analyze the risk versus the benefit in the pet taking the medication. I've not seen any issues with any of the preventions that I've had, but of course you want to make sure they're on heartworm prevention. Honestly, I'm not really picky about which one they're on, as long as they're on something. I also would rather, if you can't afford heartworm medication and flea medication, always choose heartworm medication over flea medication, because we can treat fleas very easily. It's typically inexpensive. But if your pet gets heartworm, that's life-threatening and it's very expensive to treat. And if you don't treat it, at some point they will definitely pass away. Oh yes, thank you for the feedback, you all. One thing I left out on the dogs is annual lab work. Um, see, my supporter here said, especially over 7 years of age. I would even challenge that. I would say if your pet is 3 years old, there's different packages in regards to blood work that we can do. We can at least do a young or junior's lab work panel compared to a senior. But if your pet is over 3 years old, you should be doing annual lab work as well. And this is to help us catch things like kidney disease, liver disease, um, anything that may show up on diabetes, anything that may show up on lab work. Your dog also can get hypothyroidism. Most of our humans should hopefully be familiar with that, but it is something that humans struggle with as well. Your dog can get the same thing, causes them to sometimes have skin issues, but the biggest thing we see is chronic weight gain. They have trouble losing weight, and cats actually get the complete opposite. So thank you for that. Definitely want to do annual lab work. All right, so I'm gonna go to cats, and I'm writing down best advice for supplement for lipoma. Okay, I wrote that down. All right, so for our cats are very easy. What we need to do is break down whether the cat is going to be an inside only cat or a cat that's going to potentially have access to the outdoors. So, of course, just like the dog, cats will need the rabies vaccines. They will always need rabies vaccines. So, with the nonprofit, we're hoping to be able to help do more of a catch and release program where we will catch the stray animals and kind of fix them, give them a rabies vaccine, and then we'll release them back to go, and live their lives outside. But that at least helps them not reproduce and ensure that they don't have rabies, the rabies virus. So with our nonprofit, we're planning to help with that as well. But yes, number one, you want to do your rabies vaccine on your cat. And then there's one core vaccine outside of rabies called the FVRCP vaccine that is an upper respiratory vaccine. It protects and prevents, hopefully, if the vaccine is administered in time enough, to prevent like herpes virus, calicivirus, viruses that typically cause upper respiratory symptoms. So you want to make sure that that vaccine is administered irrespective of if they go inside, if they stay inside, or if they go outside as well. Now, for outside cats, there are two illnesses that can be transmitted very easily. The first one that I'm going to talk about is FIV, which is very similar to HIV in human. This is transmitted through bite wounds, and typically cats can be very territorial. So if they are outside and you have intact or unneutered male cats, they're typically the ones that gets into the fight because they're trying to uphold their territory. When they actually get into a fight, they bite each other, and that's how they actually transmit the FIV virus. There used to be a vaccine against it, but the issue is that if the pet was vaccinated and they tested positive, we didn't know whether it was the vaccine that was causing them to test positive or if they actually had the virus. So unfortunately, the FIV vaccine is no longer available. FIV positive cats can live a healthy lifestyle, but it is best if they are in a single cat household without having any access to the outdoors, just to make sure that if they do get bitten or scratched, they don't have an issue healing, from bacteria, etc. Because it's a virus that can potentially cause immunosuppression and suppress their immune system, which will allow them to get sick. So if your pet goes outside, I do recommend getting them tested for FIV every single year, because if they get it or if they have it, you need to know that because their lifestyle drastically needs to change to prevent them from becoming further ill. Um, Now, the other vaccine that I'm going to speak about is called feline leukemia. It can be transmitted in cattery shelters. Even if you have multiple cats in your house, it can be transmitted simply by sharing a water bowl. So it kind of lives in the saliva. So anything the infected animal touches, a healthy pet can also come behind it and get the same thing. So that's the FELV virus, and there is a vaccine to protect against that. So typically, there's a combo test that tests for feline leukemia, FIV, and heartworm disease in cats. And a lot of times, we typically do that, or at least offer it once a year when the pet comes in for the annual. So we'll test for that. Just keep in mind, you can vaccinate against FELV, but FIV, you cannot vaccinate against. And if they are positive, they should be in a single cat household. Just as dogs, cats should also be, tested for intestinal parasites. They also should receive annual lab work as well. Cats are very prone to chronic kidney disease. So a lot of times we really try to screen them to make sure that they don't have kidney disease and we just not know about it, because they can use something similar to dialysis that can kind of prevent them from having a tough time battling renal or kidney disease. So for the most part, I think we talked about the most common wellness things your pet needs in regards to cats and dogs. And guys, keep in mind that these services honestly aren't that expensive. I will say that as a puppy and as a kitten, they will need to come in once a month for at least 2 to 3 months just to make sure that they are fully vaccinated. But after that, we're only seeing you once or twice a year, unless your pet becomes ill or has some type of infections that needs to be seen. All right. Any questions, guys? And we're going to go back through all the comments and make sure we address all of them. Any questions? Yes, we are open to traveling. If you are in an area or a state that is in desperate need of vet care, we can set up an event where we offer vaccines and things like that to the community. So if you can't inbox us, definitely let us know. I see New York in the comments, California. Any areas that you all need. Keep in mind, we also have colleagues that may be close to you that I went to school with or that I just know. There's a lot of great veterinarians out there. So just let us know if you need anything, and we'll try to see what we can do to bridge the gap. All right. So I see a question here that's asking about lipomas. A lipoma is a mass that's typically on your pet's skin, and although it's not not metastatic, it's not typically metastatic. They can grow, although they are benign. If they do grow and they're in a really bad area, that can cause concerns in regards to surgery. So ideally, if it is a lipoma, irrespective of where it is best to get it removed when it's very small, because a lot of time as the pet ages, they may develop, diabetes, kidney disease, things like that. They may make anesthesia quite risky. So if your pet's getting a dental cleaning or sedated ear cleaning or anything that will allow the veterinarian to take the tumor off, it is best to just go ahead and have it removed as soon as possible. And I will be probably within the coming weeks. I just actually lost my baby to bone cancer. It popped up out of nowhere. It was nothing I could have done. She just woke up one day limping, and that's just things that you don't anticipate. So just make sure you're paying attention at home, because had I not been paying as close of attention, I probably would have missed her symptoms that she was having that kind of told me that she had cancer. So, all right. Let's see. Any other topics that you all want us to discuss or talk about? This is just an introduction. We're going to start off with the more common things, and then, of course, as time goes on, we can, add different subjects, different topics, and then go from there. All right. I see a topic of food, which is extremely complicated for a lot of different reasons. Food can be quite complicated, but we'll add that. Just make sure that you are not using a grain-free diet. Grain-free diet has been linked to heart disease in dogs. I have diagnosed cases myself, and it is quite sad. The youngest baby, I think, was 6 months of age, and her name was Aria. I actually trained her during the pandemic, and she had heart disease because she was fed a grain-free dog food. Grain-free food sometimes do help with skin issues, but it's not a good idea to trade skin issues for heart disease. So I rather feed the grain-free diet, speak to a dermatologist, a vet dermatologist, and they can help you figure out the skin issues. But definitely don't feed the grain-free food until we figure out why it's linked to heart disease. There's some research going on to figure it out, but just be patient with us until we get that confirmation. Any other topics? Anybody? Perfect. What about chicken? Actually, the most common food allergy in dogs is chicken. Based off of what I've seen and the research I've done, there is chicken byproducts in a lot of the food. So you want to make sure that if your pet is having allergies, that you speak to your veterinarian about possible food allergies. And a lot of times, chicken may be an allergy that they're dealing with, but it don't have to be. So just keep that in mind. Yes, no grain-free dog food. Please, no grain-free dog food. All right. All right. So we got a question about the best way to keep your pet's teeth clean. And the easiest answer I can give you is not the easiest to actually do, is to brush your pet's teeth daily, sometimes twice a day if you can. There is not a single supplement that is going to keep the tartar off of your pet's teeth. Keep in mind that dogs and cats don't have hands like we do, so they use their mouths sometimes to kind of compensate for that. So just keep in mind that just like you, even you brushing your teeth every day, sometimes 2-3 times a day, you still every 6 months supposed to go in for your dental cleaning. Pets are honestly the exact same way. Now, some pets can go a year, potentially 2 years without needing the cleaning. If you are taking care of it at home, the dental brushing, there's water additives that you can get. It's really enzymes to break down hard tartar on the teeth. But there's nothing that you can give to prevent a pet from needing to have a dental cleaning. I understand that as the pets gets older, you get more and more concerned about, anesthesia, etc. Honestly, I've anesthetized 16-year-old dogs, 17-year-old dogs. As long as we do a thorough workup before anesthesia, I've not really had any issues at all. Now, anesthesia, it is risky. There are some unknown things that can happen. We can't predict everything, but what I will say is that your pets not getting a dental cleaning can shorten their lifespan compared to you not administering anesthesia when your pet actually qualifies for it. So yes, frozen carrots are good. Any kind of frozen vegetable is great. If you're gonna give bones, you just want to make sure that they're not too hard and your pet's not chewing to the point to where their teeth are becoming excessively worn down, or that they're actually breaking their teeth. Some dogs have um, great jaw strength, so as they're chewing, if the bone is hard, a lot of times they'll get a fractured tooth as well. So just keep that in mind. There's a lot of supplements in regards to teeth. Also, dental calculus on the teeth can potentially have a genetic component. So the genetics of the dog sometimes can aid in whether the pet has really bad teeth or not. In addition, if your cat or your dog eats more wet food or soft food, a lot of times their dental tartar is going to be much worse compared to if they were eating a hard food or food that's crunchy. Yes, I'm glad you caught that and changed the treats and didn't give them any more bones, because they can mess their teeth completely up, and dental work is expensive, guys. If your pet has to have any teeth taken out, it is extremely expensive. You probably won't be able to get out of the veterinarian's office with a bill under $1,000 from a broken tooth. Even dental cleanings can be expensive. Now we do a special during dental month. Dental month's coming up. It's February of 2026. We run our special from February all the way until April. So we do discounted dental cleanings the month of February. So your veterinarian may do that. You may want to just kind of inquire to see if they do run a special for dental month. If not, typically it's specials going on. So that's the time. If you are financially restricted, that's the time to get your pet's teeth cleaned, when there are dental specials going on, and that's the month of February. All right, guys. Any more questions before we end the live today? I appreciate everybody's support. If you can share the live, um, follow us on all platforms. We are appreciative, and we look forward to seeing you all at some point. Annual dental cleans and x-rays are offered within, yes, wellness plans. Yeah, and if you don't have a wellness plan, you can try to get one. I don't think they are beneficial for all cases and all pets, but if it works for you, then definitely get one. I would encourage you to get pet insurance if you can afford a wellness plan. I honestly prefer you pay for pet insurance, because the pet insurance will pay for the things that you just do not anticipate happening. And there are some that work similar to human insurance. So if you come in and the bill's $1,000, you may leave out paying $100 compared to paying the full $1,000. So there are insurances that'll pay us directly, so that you don't have to leave out paying a lump sum and wanting to be reimbursed. But I personally, if you can afford it, definitely, if you can do the wellness plan, do the wellness plan. But I personally recommend getting pet insurance over the wellness plan, because the pet insurance is going to take care of things that you just did not anticipate. All right. Oh, thank you. Thank you for the comment. We appreciate that. All right, guys. So if you can just shoot us some more questions. We will send out when the next live will be, likely in 2 weeks. If you can send, we got a lot of stuff to talk about, but we also want to get your questions answered and tailor the live streams to the content that you all are actually interested in. Other than that, we do have a list. We'll kind of go down our list and go from there. But if you have any questions, if it's any way we can help, if you have students looking for mentorship, pets that you need second opinions on, if you would just like to do a meet and greet, an appearance, anything you need, definitely let us know. You can inbox us or shoot us an email. Our website is softpawsac.com. That's SOFTPAWS. A is an apple, C is in cat.com. So if you need us, just let us know. But until then, we appreciate y'all, and just look out for the next live stream. All right, we'll appreciate you.